And as was mentioned earlier in the show, the focus of this segment is going to be talking about dialysis treatment now being offered at Belize Medical Associates and the partnership that is making this happen. So joining us is Dr. Fernando Cuellar, internist at Belize Medical Associates, and we're joined by Carlos Perera, managing partner of Dialysis de Belize. Good morning, gentlemen, and welcome.
Morning, Marlene, and as usual, thanks for having us on.
Yes. Well, this is definitely a service that we know is very essential in the country. Unfortunate in some instances, but very much necessary. So I want to start off first with talking to Carlos about your company called Dialysis de Belize.
Well, Marlene, we've been in existence since October of last year. We have been operational since then. We have approximately 16 machines in country. We have one at Belize Medical Associates, and we have 15 at our clinic in Orange Walk district. I can say that we're up to almost 20 to 25 patients in our clinic as we speak right now in Orange Walk. And as we've realized, the demand and need, as Dr. Cuellar will explain to you, is high in this country. Affordability was one of the factors, and opportunity of acquiring the service was also another factor. And with that said, we are working in collaboration with Dialysis de Honduras, who have been in business since 1999. They basically have over 400 machines in Honduras. They have over 10 clinics. Actually, they're building 2 more as we speak right now, one in Copan, and another in another area. I think it's in Tegucigalpa. But with that said, we are now here in Belize, and we've realized that there's a key relationship that can be established with Belize Medical Associates. Belize Medical Associates has been known to be one of the long-standing and very stable hospitals private hospitals in this country. And so we looked at that, and so now we're here, and we want to garner to get to the Belize City market. And that's where we have come to work with Dr. Cuellar and BMA.
Yes, well, we at Medical Associates definitely felt that was one of the shortcomings we had, a service that was missing at Medical Associates, dialysis, substitution for kidney function. We had to use the other facilities to accomplish that. So we definitely recognized the need, and the idea came up that instead of doing a totally new investment, why don't we just try to partner with Dialysis de Belize for them to help us fulfill that service. So as the first step, what we're doing is that patients who develop kidney failure acutely, meaning from one moment to the next, we'll be able to offer that service at Medical, with the vision that eventually we can do what we call chronic patients, put up a center there, perhaps within the year for that to happen in Belize City.
And that's a great opportunity to talk about the reasons as to why we see people needing this particular service and how often you encounter it.
Well, like I said, the first thing is the definition of the patients that need it suddenly, acutely. That's not too often, fortunately. People who would come in with trauma, who would come in infections, who would come in with heart failures, pregnancies, for example. These are the patients who would develop kidney failure and would need to have a dialysis session done. So instead of going and acquire and training and investing all of that, why don't we just kind of partner with the Dialysis de Belize to have that done, and then expand eventually to have patients who unfortunately require dialysis session long term. Okay.
Now we know that oftentimes when we talk about dialysis, we're talking about persons who develop complications from diabetes as well, which is a major concern in this country. Is that part of what you see when you're making diagnoses as well?
Definitely. People who are diabetics, for example, can also have other problems happening to them and develop kidney failure suddenly. So that's what one of the goals that we're going to fulfill at Medical at this point. And like I said, we're already thinking about having a space for some machines there to eventually fulfill the long-term need for them.
So you have seen a demand within your institution?
Oh yes, absolutely. But we were kind of handicapped or crippled by not being able to offer it. And instead of doing, because we do have other projects ongoing, for example, much bigger projects that's taking a lot of funding, like imaging, for example. We're acquiring a new CAT scan machine, top of the line MRI machine. We have to build a building, and perhaps we are running in the millions already. And of course, what we at Medical stand out for, that we do things responsibly. We borrow and we pay back. Okay, so
instead of venturing into establishing your own center, you partner with Dialysis de Belize to have the service available in your clinic, in your hospital.
And they bring the machines, they bring the technicians, they bring the trained
And that was going to be the question that I asked, because you need trained persons to be able to use these machines. You have your own technical team?
Yeah, what it does is it strengthens Belize Medical Associates for the fact that we basically have the technical aspect and support from Honduras, where all of our technicians are fully trained. We have that back-end support in that regard, and most important, it's not a secret. We can make the cost so affordable, Marlon, for the fact that we have the purchasing power in Honduras. When they're purchasing for 12 clinics. So that cost can be passed on to us here in Belize, which is a help not only for us, but it's a help for the patients. Because when we came into this country, patients were paying $450, $500, $600, $700, $900 per session, depending on the case of those sessions. I mean, in Belize, the furthest that we have gone, the lowest that we've gone up to now is $200 for a regular chronic case, and for emergency cases, we're looking at $450, and that is still far less cheap. An emergency case is far less cheaper with us and Belize Medical Associates than any other person or any other institution offering the emergency acute cases in this country. And then not talk about the chronic. I mean, the chronic is only $200 per session.
So chronic means you need to continuously be doing that. So you do, and that was the question I was going to ask, because dialysis is infamous for being very, very cost prohibitive, especially for persons who rely on it for their lives, to be able to maintain their life.
So that's why I want to say this morning and make it known to the general public that with that one machine that we have at Belize Medical Associates, we want to make it known today that we will start doing chronic cases with that one machine at BME. Not only doing acute, but we'll also start doing chronic cases for BME as well.
And I mean, I think like every other thing, when you pull resources together, you usually get better results. So all I need to do is pick up the phone and say, you know what, we have a patient, and the nurse come, the specialized nurse come, the technician come, and thankfully I have the backup of a nephrologist. That's many times is in country and is on the phone, or the technology we have now, we can have that backup, and that's important, having a nephrologist manage basically the patients.
Which is a kidney specialist.
Kidney specialist.
And you have a visiting nephrologist who comes often, right? Because we don't have one in country at this point.
Which is part of Dialysis de Belize. So they have the whole set up, the whole support. We only have the infrastructure, the physical space there at Medical.
Dr. Cuellar, remind us again what the dialysis machine actually does.
Well, it's an artificial kidney, basically. When people's kidneys go bad, we connect them to this machine via what is called a catheter, where this machine, what it does, it takes out the blood, cleans it, and then puts it back into the person. So that's what it does, the function of kidney externally to the body now.
Do you have access to blood supply as well? Because we know sometimes that is a need for dialysis patients.
Oh yes, we do have the way we manage how we are allowed to do to manage blood products here in Belize through the blood bank. We have that nice access. As a matter of fact, I think just last week we met with the CEO in the Ministry of Health to try to improve that accessibility to blood, and he promised to look into it so that we're quite self-sufficient with blood supply there.
Okay. Now, what do you want to tell people? I know obviously one of your major points in establishing this partnership was keeping it affordable for both chronic patients and those who require emergency care. What has been the response since you've been putting together your packages?
Well, it's just been maybe a month or so, right, Carla? So we've started slow. We've only had a couple of patients, but I guess now that the word will be out, we're going to see a more access to the service at Medical.
But what is important, Marlene, is that the experience and professionalism that we bring to the table is getting those patients back on their feet. One of the things that when we met with Dr. Cuellar and their team, we always believe that our patients, and patients that have been with us at our clinic, we've been able to get them back on their feet within 6 weeks. And that's what we want to bring, and that's what BMA is known to be, quality. And we want to bring that quality to them, to be able to get patients back on their feet, for them to be able to live a normal life. A lot of people in the country are not really too informed of what dialysis is all about, and so they get a little bit tense in believing that, oh, if I have to go on dialysis, my life is over. It's not. It's this service that we're teaming up with them to work along that will help you prolong your life, will be able to get you back on your feet. In Honduras, patients get up in the morning, go dialyze, go to work, and then they go home, and it's part of their routine. And so it's getting Belizeans to understand that, listen, it's now in the country, it's now coming to the city now, it's affordable, it's going to make you live a normal life. You don't need to be worrying about going all the way to Merida. You don't need to be worrying about going all the way to Chatamal. You don't need to be worrying about, well, I can't afford it right now in Belize City. You can now. It's here, the service is affordable, and we're going to be growing and working with them. And most important is we have that back-end support with BMA. So if you have an emergency issue, if a patient crashes at that point in time, you know you have an immediate hospital right there at that point. You have an internist like Dr. Cuellar to jump on board and so forth. So it's putting the package together and having that whole service for patients, and bringing our quality from that in. And most important, like he said, we have our nephrologists. We have several nephrologists in Honduras, and we have them working along with us through Skype. We communicate, they come and do their visits and so forth from that end. Because we still have to do not only offering the service, but we also have to do preventative care and advise them of what their diet is and so forth, of how to take care of themselves. Patients at our clinic have been doing so well that they forget that they need to watch their diet. So we have to remind them about that as well.
And the patients at your clinic, they're mostly, are they chronic cases or mostly?
They're all chronic. They're only chronic, because we're an outpatient clinic, so we're all chronic cases, basically. And that's the reason why we established the acute cases with BME for those particular cases, because we're not a hospital, we're only an outpatient clinic. And with that said, well, we have patients from all over the country. I have patients from Dangrega, from Cayo, from Belize, a couple from Belize City, and mainly from the north, basically. So.
Yeah, well, there is the Ministry of Health program, but not everybody is approved for it or can be able to, qualify for that program. So having an affordable option will be very helpful for others as well.
As a matter of fact, I think long-term, a good planner in the Ministry of Health would eventually see the need to partner with somebody private to have that service. And it's not no invention of mine. We look at the whole healthcare reform project that was seen and studied many years ago. It's best for government to partner to outsource different services. It's far more cost effective and quality is better if you do that. No, if government tries to do everything, then it won't go anywhere. I mean,
so what is the timeline in terms of establishing the clinic? Is this kind of just the testing phase with the one machine and seeing what the response will be?
Yeah, we have to go slow and responsibly. We have to make sure that we have everything done properly. And I would think at least within the next 6 months to a year, we would have a more bigger service available at medical. No? We're starting small, baby steps. Okay.
And it is already rolled out, as you pointed out. So people can already go to medical associates and get dialysis
within the next hour.
It's right available. It's available. We did a couple cases already, and we tested it, and we have experienced nurses on board with us, basically. Everyone knows that the service is necessary, and now it's available. That is what is important, convenient, and affordable. So yes, it is there. We have it there at BMA. It's just a phone call. If you need that particular service, we get our technician, we get our nurse on board. Naturally, we need to be scheduled. You need to be scheduled.
Yeah, that was going to be the question.
And we need to properly have them properly informed, so they can inform our clinic, so we can make the logistics on a timely basis for it to be accomplished. And believe me, the BMA, the environment where they have set the machine and so forth is excellent. I mean, So we did a couple of patients. The patients they got back on their feet, they went home, and so it's there. So it's basically reaching out to the Belizean public
and letting them know that the service is available
here in the city, and we're going to be doing both acute and chronic at BMA.
Yeah. And in terms of being able to make an appointment, do you have to get an assessment as well in terms of what your needs are or what complications you're prone to?
Yes, you will, of course, need to make an appointment, either to see myself or one of the other internists, and then we take it from there. No? We assess the person and see what their requirements are, and we make the phone call and set up, which can be done from one day to the next or even the same day. No?
Yeah. And your cost for chronic is $200, and emergency is?
It's about
$450. Something like that. Yeah.
All right.
So that is beyond comparison of what the service is and what they can afford, basically. So, but with that said, we have the support, we have the team of BME, and along with our team, and I think that's what empowers the service now to make it affordable for the people in this country. Yeah. And they can get in contact with the Belize Medical Associates. They can get in contact with I believe it's Ms. Tamara Vasquez, Ms. Tamara Vasquez at Belize Medical Associates. She will be able to make the arrangement with us, and we will get the team. And it's not like when you see our team coming down and putting it together and walking in there and so forth, that it's available.
It's already there. You just bring the technical persons to do the session.
Exactly.
Yeah.
All right, and the session, is it available only during certain hours or at any time?
I think right now it's available from Monday to Friday, and definitely on weekends, if the need arises, we can set that up for sure.
Okay. Well, gentlemen, thank you very much
for
coming.
Sweet.
Yes, thank you for coming and telling us about, I think we've spoken a lot about dialysis and kidney disease on the show, so people know that there are persons out there who need this service, and knowing that there's now another option available and one that is affordable is definitely important as well. Thank you.
Thanks, Marvin.
We're going to go ahead and take a break, and when we come back, it's to talk about World Customs Week, so stay tuned.